Today, we're talking about something that gets overlooked way too often, the skin around the wound. It's called the periwound, and by the end of this video, you'll know exactly how to keep it healthy, protected, and working with the wound, not against it. We usually focus on the wound itself, right? The size, the depth, the drainage. But sometimes it's the skin just outside the wound that gives us the biggest clues and causes the biggest problems. Let's break down what periwound skin is really telling us. For those who don't know me, my name is Dr. Voltaire, a wound care physician, and I've seen wounds stall or worsen not because of the wound bed itself, but because the periwound was dry, soggy, irritated, or breaking down. But once we give that skin the care it deserves, healing picks up speed. If you've ever changed a dressing and noticed redness, peeling skin, or rawness near the wound and thought, what's going on here? You're not alone. The good news is there are simple things you can do right at home or bedside to fix it. Here's what we'll cover today: what healthy periwound skin looks like, what to do when it's red, peeling, soggy, or painful, my go-to products for periwound protection, and when you need to change your dressing routine. And at the end, I'll show you the one thing I always check before applying any new dressing, no matter how small the wound is. Let's start simple. The periwound is just the skin around the wound, usually the 2 to 4 centimeters outside the edge. But that skin is doing a big job. It's absorbing moisture. It's trying to stay intact while dressings come on and off. It's often the barrier between infection and the rest of the body. Therefore, if we ignore it, we miss a huge part of healing. Healthy periwound skin is usually smooth, intact, dry but not flaky, no pain, itching, or redness. It's like the frame around a picture. If it's cracked or falling apart, the whole image is harder to protect. But if you notice redness, rashy patches, or soggy skin around the wound, that's your sign the wound care plan might need a change. Here's a word we use a lot: maceration. It means the skin is getting too wet. This can happen when the dressing is leaking, the drainage is soaking the edges, you're changing dressings too infrequently. What does macerated skin look like? It's pale, sometimes wrinkled or white. It may feel soft like wet tissue, and often it breaks down easily when touched. Therefore, if you see this, the fix isn't more cream, it's adjusting your dressings to better manage moisture. On the flip side, some wounds are in dry areas, especially in older adults. Think about legs, especially in folks with poor circulation. The skin gets flaky, cracked, itchy. That dryness can lead to tiny tear openings that can turn into wounds. So what can you do? Use gentle moisturizers, but not on the wound itself. Apply lotion around the periwound, not inside it. Choose dressings that help hold moisture without soaking the skin. And most importantly, hydration matters from the inside too. Encourage water intake if possible. Let's talk tools. When I need to protect periwound skin, these are my go-tos. Zinc oxide is great for raw, irritated skin. Barrier wipes are fast, easy, and dry quickly. Petroleum-based ointments for dry or cracked areas, especially around the feet. Silicone bordered dressings help avoid tape damage. Here's the key. These products aren't fancy, they're just consistent. And when you use them right, they can make a huge difference. Let me tell you about Mr. C. He had a sacral pressure injury that was starting to heal. The wound bed looked good, nice red granulation, but the skin around it, red, fragile, and peeling. Why? Because the moisture was soaking through and the foam dressing didn't extend far enough. We added a moisture barrier around the wound edge. We used a bigger, more absorbent foam, and we made sure we checked the skin every single dressing change. Within a week, the redness faded. Within 2 weeks, his wound healing picked up speed. Sometimes it's not the wound itself, it's the neighborhood around it. Here's what I always look for when I assess periwound skin: redness that spreads, odor coming from the edges, pain or burning when cleaning, bleeding when the dressing is removed, drainage soaking onto nearby skin. If you see those, it's time to reassess. Is the dressing right for the drainage level? Are you cleaning too harshly or not enough? Is the patient allergic to anything you're using? Don't ignore the signals. The periwound will often speak up before the wound does. If you're watching this thinking, I've done all the right things, but it still looks worse, I see you. Wound care is hard, especially when it's someone you love or even yourself. But this is the work: learning, adjusting, observing. And most of the time, A small tweak makes a big difference. Remember how we said the wound gets all the attention, but the skin around it is doing the heavy lifting? It protects, it absorbs, it fights off infection. When we care for the periwound, we help the whole wound heal. It's not extra work, it's the foundation. Thanks for watching. If this video helped, check out my next one on how to pick the right dressing for pressure injuries. It'll help you match the product to the wound stage and drainage. Stay informed and heal well.